Ejection fraction, also known as EF, is the percentage of blood the left ventricle, the heart's main pumping chamber, pushes out with each heartbeat. The left ventricle fills with blood, then contracts and pumps blood to the body. Not all the blood is pumped out each time. For example, if the ventricle fills with 100 milliliters of blood and pumps out 60 milliliters, the EF is 60%. Normal EF ranges 55 to 70%. 50 to 54% is low normal. 41 to 49% is mildly reduced. Less than or equal to 40% is heart failure with reduced EF. Less than or equal to 35% is severely reduced EF and may qualify for an implantable cardioverter defibrillator if medications are ineffective or if EF does not improve. A lower EF means the heart is not pumping blood effectively, and you might feel fine until you don't. Then, low EF can be felt as fatigue, shortness of breath, exercise intolerance, like unable to walk a block without sitting down, fluid retention causing you to cough, or swelling in the legs, or swelling in the abdomen causing a feeling of fullness. However, a person can have severe symptoms with a normal EF, and some people with a low EF have few symptoms. That's why doctors also look at symptoms, exam findings, and other tests. When blood pressure is high, the heart must pump against greater resistance. Think of it like trying to push open a door with someone pushing back from the other side. Over time, in the early stage of low EF, the heart muscle becomes thicker to handle the extra workload. This is called left ventricular hypertrophy, LVH. At this stage, EF is often normal. The heart becomes stiff and doesn't relax well. Years of uncontrolled hypertension can cause the later stage of EF with enlargement of the left ventricle, weakening of the heart muscle, and declining EF. This can lead to heart failure with reduced ejection fraction. Hypertension can cause two types of heart failure. One is preserved EF. This happens when EF remains normal, usually greater than or equal to 50%, and the heart is stiff, causing a filling problem. The second type of reduced EF happens when EF falls below normal and the heart is weak, causing a pumping problem. Both types can cause shortness of breath, swelling, fatigue, and hospitalizations if not corrected by medication or other means. Good blood pressure control can reduce the risk of heart failure, prevent coronary artery disease, prevent left ventricular enlargement, and sometimes improve EF if damage is not permanent. For many patients, maintaining a blood pressure below 130/80 significantly lowers the risk of developing heart failure and other cardiovascular complications. Once you have a low EF, you will likely need a lower blood pressure target goal like 90/100/50/60. High blood pressure is one of the most common causes of heart failure. The heart spends years pumping against high pressure, causing it to first become thick and stiff, then eventually enlarge and weaken. When the heart weakens, the ejection fraction may fall, meaning less blood is pumped to the body with each heartbeat. High blood pressure contributes to coronary artery disease, CAD, by damaging the arteries over many years. Cardiac catheterization or coronary angiogram is considered the gold standard for diagnosing CAD. Important to know that controlling blood pressure is one of the most effective ways to prevent heart failure, and it can help improve some forms of existing heart failure.